How often do you think about your prostate? Well, prostate health affects everything from your bathroom habits to your overall well-being. Yet many men dismiss the early warning signs until they become impossible to ignore. Today, I want to talk about 6 early signs that too many men brush aside as just getting older or nothing serious. One of the first signs that something might be wrong with your prostate is having trouble starting to urinate. You may find yourself standing at the toilet, waiting and straining before the flow finally begins. This happens because an enlarged prostate can press against your urethra, the tube that carries urine from your bladder out through your penis. When this tube gets squeezed, it becomes harder for urine to pass through. Another sign to watch for is a weak or slow urine stream. Where you once had a strong flow, you might notice it's now weak or takes longer to empty your bladder. This change doesn't happen overnight, which is why many men don't notice it at first. It's like a faucet that gradually loses water pressure. You might not notice day to day, but over time, the difference becomes clear. Waking up multiple times during the night to use the bathroom is another common warning sign. Your body makes less urine at night, so healthy men can usually sleep through the night without needing to urinate. If you find yourself getting up 2, 3, or more times each night, your prostate might be the reason. This happens because the enlarged gland prevents your bladder from emptying completely, causing it to fill up again faster. The feeling that you can't fully empty your bladder is closely related. After urinating, do you feel like you still need to go? This incomplete emptying sensation happens when the prostate blocks the flow of urine, leaving some behind in the bladder. Over time, this leftover urine can cause bladder infections or even damage to your kidneys if not treated. Urgency is another sign many men ignore. This is the sudden, strong need to urinate that can be hard to control. You might find yourself rushing to the bathroom with little warning, worried you might not make it in time. This happens because the bladder becomes more sensitive when it's constantly fighting against a blocked outlet. Pain or burning during urination isn't normal and should never be ignored. While it might be a urinary tract infection, when it happens regularly, it could point to prostatitis, inflammation of the prostate gland. The pain occurs because the inflamed tissue is sensitive, and urine passing through the irritated urethra causes discomfort. Some men also experience pain in unexpected places. Discomfort in the lower back, hips, pelvis, or even upper thighs can sometimes be linked to prostate problems. This happens because the prostate can press on nerves that connect to these areas, causing pain to spread beyond the prostate itself. What's happening inside your body when these symptoms appear? Your prostate naturally grows throughout your life. This growth often speeds up after age 50, leading to what doctors call benign prostatic hyperplasia, or BPH. Benign means it's not cancer, but that doesn't mean it can't cause problems. As the prostate grows, it can squeeze the urethra like a clamp on a garden hose, causing the symptoms we've talked about. Have you noticed any of these changes but brushed them off as just part of getting older? While these changes are common, they aren't something you should simply accept without talking to a healthcare provider. Medical research shows that about half of all men will have an enlarged prostate by age 60, and this number jumps to 90% by age 85. These numbers tell us something important. These changes are extremely common, but common doesn't mean they should be ignored. Studies have found that men who get help early have better outcomes and fewer problems down the road. Let's look deeper at these 6 warning signs and what science tells us about them. First, trouble starting to urinate happens because the bladder has to work harder to push urine past the enlarged prostate. Over time, the bladder muscles can become thicker and stronger as they try to overcome this block. This is why you might feel the need to strain or push when starting to urinate. The weak or slow stream that many men notice happens for a similar reason. Tests that measure urine flow show that a healthy flow rate is about 15 to 20 milliliters per second. Men with prostate issues often show rates below 10, sometimes even as low as 5 milliliters per second. This slow flow isn't just annoying, it's a clear sign that something is blocking the normal path of urine. Nighttime urination, which doctors call nocturia, has been well studied. Research shows that getting up more than once a night to urinate is linked to poorer sleep quality and higher rates of daytime tiredness. This can affect your work, your driving, and your overall quality of life. One study found that men with severe nocturia were twice as likely to fall compared to those who slept through the night. The sensation of not emptying your bladder fully can be measured by doctors using an ultrasound test. This test can show how much urine stays in your bladder after you think you're done. Healthy men usually have less than 50 milliliters left behind. Men with prostate problems often have 100 to 200 milliliters or more still sitting in their bladder. This leftover urine is a perfect place for bacteria to grow, which explains why men with prostate issues get more urinary tract infections. The urgent need to urinate happens because your bladder becomes more sensitive when it's constantly fighting against resistance. Brain scans of men with this problem show increased activity in the areas that control urination, even when the bladder isn't very full. This helps explain why the urge can feel so strong and hard to control. Pain or burning during urination is often caused by inflammation. When the prostate becomes inflamed, it releases chemicals that irritate nearby nerves. Blood tests can pick up higher levels of these inflammatory markers in men with prostatitis. This inflammation can be caused by bacteria in some cases, but often no clear cause is found. The pain that some men feel in their lower back or hips happens because the prostate sits near many important nerves that connect to these areas. When the prostate presses on these nerves, pain can travel along them to distant parts of the body. Hit the subscribe button if you appreciate health advice. It helps us create more content you can use. This is called referred pain, and it's similar to how heart attacks can cause pain in the left arm. Early detection makes a big difference in treatment options. For example, men who catch BPH early might manage it with simple lifestyle changes or mild medications. Those who wait until symptoms are severe might need surgery. Did you know that drinking too much before bedtime or certain medications like antihistamines and decongestants can make these symptoms worse? The truth about prostate health involves both good news and some cautions. The good news is that most prostate changes are not cancer. Benign prostatic hyperplasia, BPH, and prostatitis are much more common than prostate cancer. An enlarged prostate doesn't mean you'll get cancer later. These are completely different conditions, even though they can cause similar symptoms. Another positive is that treatment has gotten much better in recent years. Newer medications can shrink the prostate or relax the muscles around it, making urination easier without major side effects. Many men see big improvements within just a few weeks of starting treatment. These medications work for about 2/3 of men who try them. For those who need more help, there are now minimally invasive procedures that can be done in a doctor's office with little downtime. These treatments use heat, water vapor, or tiny implants to reduce prostate size without major surgery. Recovery is usually quick, with most men returning to normal activities within days instead of weeks. But there are also things to be careful about. Waiting too long to get help can lead to serious problems. If your bladder never empties completely, over time the leftover urine can cause infections that keep coming back. These infections can move up to your kidneys and cause damage there as well. The bladder itself can also be harmed by constantly pushing against resistance. Just like any muscle that works too hard for too long, the bladder can eventually weaken and lose its ability to contract properly. This can lead to a condition called overflow incontinence, where urine leaks out without warning because the bladder can't empty normally anymore. One common myth is that difficulty urinating is just a normal part of getting older that can't be helped. This simply isn't true. While prostate changes are common with age, the severe symptoms that affect daily life can almost always be improved with proper care. Another misconception is that all treatments will cause sexual problems. While some older treatments did have this risk, many of the newer medications and procedures have much lower rates of sexual side effects. It's important to talk openly with your doctor about these concerns so they can choose the right treatment approach for your specific situation. Some men worry that seeing a doctor about these symptoms will automatically lead to invasive tests or surgery. In reality, most men start with just a simple physical exam and maybe a urine test or blood test. More complex tests are only done if needed, and surgery is rarely the first option. Over time, untreated prostate problems tend to get worse, not better. The prostate continues to grow throughout a man's life, so symptoms that are mild now can become severe years later. The bladder changes mentioned earlier also worsen with time, making treatment more complicated. What about practical solutions you can try at home? Some simple changes can make a big difference. Cutting back on fluid intake in the evening can reduce nighttime bathroom trips. Avoiding caffeine and alcohol can help too, since these irritate the bladder and make you produce more urine. Certain medications like decongestants, antihistamines, and some antidepressants can make urinary symptoms worse. If you're taking any of these, ask your doctor if they might be contributing to your problems. Double voiding is another helpful technique. This means urinating normally, then waiting a minute and trying again to empty the bladder more completely. Simple pelvic floor exercises, similar to those women do after childbirth, can help strengthen the muscles that control urination and improve symptoms in some men. Have you ever considered how your weight affects your prostate health? Extra pounds, especially around the middle, can put pressure on your bladder and make symptoms worse. Losing even a small amount of weight can sometimes bring noticeable relief. Taking care of your prostate health doesn't have to be complicated. Regular checkups are one of the best ways to catch problems early. A simple blood test called PSA, prostate-specific antigen, can help spot potential issues before symptoms even start. For most men, a yearly checkup that includes this test is enough to stay on top of prostate health. If you've noticed any of the 6 warning signs we've discussed, trouble starting to urinate, weak stream, frequent nighttime urination, incomplete emptying, urgency, or pain, don't wait to get help. The sooner you talk to a doctor, the more options you'll have and the easier treatment will likely be. Your daily habits play a big role in prostate health too. Regular exercise, even just walking for 30 minutes a day, can reduce prostate symptoms by up to 25%, according to research studies. Exercise helps reduce inflammation throughout the body and improves blood flow to the pelvic area. What you eat matters as well. Foods rich in zinc like pumpkin seeds and shellfish help support prostate function. Tomatoes contain lycopene, which some studies suggest may help maintain prostate health. Green tea and colorful vegetables provide antioxidants that fight inflammation. On the flip side, spicy foods, alcohol, and caffeine can irritate the bladder and worsen symptoms, so cutting back on these might bring relief. Stress can also make prostate symptoms worse by tightening the pelvic muscles and increasing inflammation. Finding ways to relax, whether through deep breathing, a hobby you enjoy, or spending time with loved ones, can help ease symptoms. What can you expect if you take these steps? Most men who seek treatment for prostate issues see major improvements in their symptoms. Better sleep because of fewer nighttime bathroom trips. Less worry about finding bathrooms when out in public. More confidence in daily activities, and perhaps most importantly, prevention of the serious bladder and kidney problems that can happen when prostate issues go untreated. Your quality of life can improve dramatically with the right approach to prostate health. Thanks for watching. If you found this valuable, like the video so you can find it again when you need it.